Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse, and protectors of the developing brain. Welcome to the Cranial Doc Podcast, where we master the work that actually changes lives. Craniopathy, nervous system-based care, and the business systems that let you scale without selling your soul. I'm Dr. Anthony Pellegrino, pediatric chiropractor, certified pediopath, and proud automation geek. Let's dive in. All right. Welcome to another episode of the Cranial Doc Podcast. I'm Dr. Anthony Pellegrino, and many of you guys, most of you, some of you, especially at this point that's on this podcast, probably know that I used to run a podcast called the Chiropractic Research Breakdown, and that if you know me, you know that the levels of nerd that I'm at all the time are really, really, really high. So let's go, and in the spirit of breaking down chiropractic research, there's a study and just whole concept that I've been reading and researching on recently that has really just gotten me really, really, really excited. And we're going to talk about the red flag that you might be missing in your practice and what to do about it. So I'm scrolling through PubMed a couple months ago, getting ready to do actually two different things I was scrolling through looking for. One was my final diplomate presentation for the ICPA. Yes, I'm an ICPA diplomate. Fun. As well as presenting on cranial work, an introductory to cranial work at Dr. Amy Spolstra's Focus VIP event, which is awesome. Love her, love that program, love what they're doing. And I come across this paper that's called, here we go, right, ready? 3-dimensional analysis of upper airway and craniofacial morphology in orthodontic adolescents with attention deficit hyperactivity disorder, a comparative retrospective study. What does that mean, Doc? Well, what the authors do is they were noticing some correlations in specific changes that they were seeing in the way that the airway was structured in patients with ADHD. So they looked at CBCTs of patients from July 2014 to 2018, and they found was that there were statistically significant changes in specifically palate and airway width. It was narrower, it was more collapsed. What they found was that looking at 87 teenagers who were included in the study, and they looked at the upper airway volume and minimum cross-sectional area of the airway, and found that the ADHD group had smaller airways than the control group. They found that there was a statistical significance in the upper airway width and airway area with the ADHD group, showing narrower widths and area compared to the control group. The most common skeletal classification in the ADHD group was class 2, which is a classic overbite, then class 1, which is normal, and then class 3, which is an underbite. So 58.6, so 60% of the individuals that they assessed had an overbite. And there were no significant differences found between the groups for any other skeletal, dental, or soft tissue cephalometric variables, meaning that the size of their head. So, why is this important? Well, if you've been listening to me for a while, one of the things I talk about is that I am really passionate about working with kiddos with these sensory challenges, specifically ADHD, because listening to this, you probably know that I'm like one of those kiddos. And this airway thing is a really big thing for us. Now, what I'll go ahead and I'm going to talk about, I am the biggest fan of disafferentation. And I talk about it every single day. And what that is the 4-dimensional model of subluxation. Essentially, there's dyskinesia, which is that improper motion of the spine, especially in the upper cervical. It's going to cause disafferentation or imbalanced input up to the brain. Now, the imbalanced input to the brain is going to have a variety of responses. It's going to, of course, what we're going to expect to see is a shift towards sympathetic stress, which we measure with HRV, and that shows up with dysautonomia, meaning the abnormal function of the autonomic nervous system, as well as dyskinesis, which happens to go with abnormal energy output or abnormal muscular balance in the body. Basically, you're going to see postural changes, you're going to see energy expenditure changes, you're going to see a lot of different things. And this is essentially what is happening in a subluxated individual. Now, because this is the cranial doc, we're going to apply that same concept of, if we know that the spine is subluxated, there's a good chance that the cranium is subluxated as well. And just like birth trauma has been impacting spines for many years, what we know, especially through books we read like Jaws, which is looking at the hidden epidemic, is that not only do we have birth trauma, but we have children whose faces are developing differently than they should have 100 years ago. Reduced rates of breastfeeding, increased use of binkies, increased bottle feeding. We are not doing baby-led weaning. We're not letting children actually be able to chew food at the appropriate ages. We're using soft foods, soft textures, ice cream, everything like that. And from a cranial perspective, what this is literally doing is changing the shape of these faces. Now, why the hell do we care? Oh, sorry, if you're listening in the car with children, why the heck do we care about the changing of faces? Now, there's a number of different reasons. 70% of the central nervous system is located from above C1. And if we're going to talk a lot about, especially if you're using a tonal model when you're adjusting these kiddos, we know how important the dural system is. If there's any sort of subluxation that's impacting the dural system, it's going to cause a huge imbalance in the body. I just spent all weekend at the Syntropy Adjusting Seminar, which is my absolute favorite adjusting seminar that I've ever taken. I think that Pat and Aaron are doing a fantastic job. And I can't wait to continue to learn more from them. But we spent so much time talking about the dura and dural attachments in the upper cervical. And if you're listening to this, you're probably interested in the cranium, right? Or at least I hope you are. And those same dural attachments go throughout the entirety of the skull. And I don't know why we ignore them. Anyway, so of course, if there's a subluxation, an imbalance in the cranium itself, well, what can that do? That can cause an imbalance, a dural pulling, a dural stress. It can cause reduction of cerebral spinal fluid. It can cause all of these different challenges, right? And so we have this cranial imbalance and dural stress. So from a physical standpoint, the tugging and twisting of the dura, of course, is going to impact the central nervous system. The same way that dural stress in the spine is going to impact the function of the central nervous system as well, and has more likely to shift it for fight or flight. Cool. I hope we don't have to go deeper on that. Then we have the thought process of, well, what happens to cerebrospinal fluid? So CSF is really huge in this conversation, in craniopathy, in craniosacral therapy, and it's honestly become really massive in chiropractic as well, especially if you've read the research of Raymond Damadian with Scott Rosa. So to put really simply with this, what they've done, Dr. Raymond Damadian, who is the founder and inventor of the MRI, or is it the... I think he did both the MRI and the upright MRI, but definitely the upright MRI. So don't quote me on the MRI itself, but he's the inventor of the upright MRI. And what he started to looking at was CSF flow in individuals, specifically with multiple sclerosis. Now, what we know in multiple sclerosis is that there's sclerotic regions of the central nervous system, right? In the myelination pathway. So anyway, so what he did was he did upright MRIs, and this is really important because what he found was that in individuals with MS, they had done regular MRIs, and there was really no changes that were being found in CSF flow. But then all of a sudden, when he turned them upright, what we found was that there was this reduced drainage of CSF that was getting choked off in the spine. It wasn't draining appropriately. All right, this is really big. Well, why is that important? Now, of course, the CSF brings nutrients and temperature regulation and helps to create things, create a place for the brain to float and protection and everything else like that. But it also is responsible for drainage of toxins and metabolic byproducts through the venous system. So stagnation of CSF flow is going to cause this buildup of toxins in the brain that is going to eventually cause an increase of pressure where there's going to be now be parts of CSF that are leaching out into areas they shouldn't be. And now there's a mounted autoimmune response to attack those areas. And that autoimmune response is resulting in sclerotic regions. Now, I know we're off of ADHD here, so just bear with me if you're tracking with me so far. So what they did in this study was they brought in upper cervical specific chiropractic care to give specific adjustments to specific adjustments to the upper cervical spine to reduce the choke point of CSF so it could flow better. And I'm riffing here. I don't have this study in front of me. I haven't actually read this in years, okay? But I believe we saw symptom abatement or reduction of symptoms in 70 or 80% of cases which is really fascinating. What they also found was that these individuals with MS, granted it was a shorter study, had a diagnosed whiplash injury. I think 70% of them had a whiplash injury 11 years prior to any symptoms ever occurring from MS. So this is something that's really, really, really huge. And we're looking at these choke points that, of course, we want to be able to clear the spine. But especially in children with very movable craniums, it's not just the drainage that's happening, but the cranium moves into flexion, extension, external, internal rotation. There's a craniosacral rhythm and craniosacral pump that is happening every single second of every single day. And it is going to help to actually allow for that venous drainage to happen. Okay, there's been studies of MRI that found that children diagnosed with autism have abnormal volumes of CSF in their brain. So this is all things that, and I actually have that study name right here, so let's just pull that up. Cerebrospinal fluid and early brain development of autism. This is a 28 study in the Journal of Neurodevelopmental Disorders. Okay, so this is all stuff that's really important. We can see this abnormal CSF flow. So of course, as a chiropractor, we want to make sure that CSF is draining appropriately, right? But we also want to make sure that pump between the sacrum and the occiput, the sphenoid, is actually happening as well. Because even if there's no choke points, if the pump isn't working appropriately, if the dural system is under so much stress that the cranium actually can't go into its normal rhythmic motion, well, then that's going to cause a problem too. But again, these are different things, of course. If the shape of the face changes, which is what they looked at the study that we're talking about here, yes, that can impact CSF flow, it can impact dural stress, can impact all of these, but there's even just something that's more simple. And it comes back to that red flag. Children and adults with smaller palates and airways are going to mouth breathe, specifically at night. Class 2 is an overbite, and what happens with class 2 is that jaw gets retracted. Okay, with a narrow palate and retracted jaw, throw tongue tie out of the equation. That's another thing we could talk about another time. But that tongue isn't going to appropriately rest on the roof of the mouth. It's going to fall back. If the adenites will, if anything else happened, right? Now, all of a sudden, we're going to be opening our mouth and breathing. Okay, so we got that. Now, there's some different immune system challenges that happen, which is that if we breathe through our nose, there's cilia and there's different things and turbinates that clean up and pick up all the bacteria so it doesn't affect our tonsils and adenoids and anything else like that. And if we're mouth breathing, all of that bacteria isn't getting filtered from the air. It's specifically hitting it, and it can cause increased inflammation, adenoids and tonsil swells. It narrows the airway further, and then we have to mouth breathe more. We have less filtering, more swelling, and it becomes a feedback loop. But here is another piece. When we breathe through our nose, there is a chemical that is released in our nasal passages called nitric oxide. Now, similar to NOS, if you're a fan of Vin Diesel and the Fast and the Furious franchise, but we emit nitric oxide in our nose when we breathe. That nitric oxide is a very, very, very powerful vasodilator. So it's really important. That nitric oxide released in nasal passages mixes with the air that we breathe and gets transmitted directly to the lungs. When that happens, it allows for a massive amount of vasodilation, and especially when we're nasal breathing at night, it allows for heart rate to slow, our blood pressure to drop, and still be getting appropriate oxygenation. Now, with ADHD, one of the questions that we, as disafferentation neurologically based chiropractors, always want to ask is quality of sleep. Right? Because if we have a kid that tosses and turns all night, anything like that, right? If they toss and turn all night, it's like, okay, cool, you're not getting high quality of sleep, right? And of course, that means your body's stuck in fight or flight. You can't rest down. You can think about your brain being anxious, and like it's really hard to get sleep like that, right? And parents can really relate to that. But in many of these ADHD cases, especially if they have this mouth breathing red flag, they're not coming in saying my kid has any problem sleeping. If anything, he's a great sleeper. He's so good at sleeping. He goes to sleep, and when I go wake him up in the morning, he's impossible to wake up, and he's like still tired. He gets so much sleep all the time. I don't get it. He's just a typical teenager at 6 years old. Red flag. Because it's not the amount of sleep that's the problem. It's the quality of sleep. See, if we're deoxygenating while we're sleeping at night, we are not going to have an appropriate quality of sleep. And so what happens is, at the time of this recording, depending on where you're listening, I have 2 toddlers, 4, and 3 years old. And I think about what happens when my youngest misses a nap. And oh my gosh, by the end of the night, we are ready to get on a helicopter and leave this joint, right? Like, the witching hour is brutal. We don't want to pay attention. We're exhausted. And he has that typical toddler behavior when they're exhausted. It's like a cat. We just knock everything off the table, right? And that's typical for a child who's exhausted. And I've got these 6, 7 years old, 13-year-olds in my practice that they've not had a quality night's sleep because they don't have a patent airway, because their cranium is so freaking subluxated, and it's been subluxated for so long. Their tongue doesn't rest on the roof of their mouth. Their jaws are retracted. Their TMJ is retracted. Their palates developed like this. They weren't able to breastfeed. They weren't able to breastfeed, or maybe they did, but it wasn't great, or it stopped early, or they have all of these different challenges of cranial subluxation that nobody ever brought in. Maybe even they've seen chiropractors and their spine adjusted, and their disafferentation is underway, but there's still that missing link and missing piece, right? And they haven't had a same quality of sleep in years. And they're just stuck at that witching hour all the time. If your pediatric patients are mouth breathing, it's your responsibility as a provider to talk about how that will impact the nervous system. Because poor quality of sleep is sympathetic stress no matter what. Disafferentated or not, it's sympathetic dominant stress. And if we can jump in, use gentle, specific chiropractic cranial care to help this, if we get there early enough, we can intervene and help this pattern. We can start to repattern the cranium, can actually get to the place where we don't need to do things like palate expanders, where we can, if we get there early enough, if we have rotational and translational issues with the TMJ versus occlusal, which is probably typically where we like to work with dentists and other things like that, we can really go in there and help this child's nervous system on a structural level and get to the bottom of the issue. So, is that sleep quality, sleep quantity, mouth breathing and snoring, conversation part of your intake? Is it part of your exam? If that's coming up as positive, is that something that you know what to do with? I hope so. Because this is our biggest, I think, opportunity and responsibility, because no one addresses these patterns the way that we do. And I mean, I know that because I've taken the cranial seminars. I've done the ones that the people in your community have done. I've done craniosacral therapy. I've seen them all. I've done chiropractic cranial adjusting. And what I can tell you is that the depth and knowledge of what we do as a profession is unlike anything out there. Yes, we can work with other providers like myofunctional therapists. Yes, we should absolutely have a holistic and airway-based dentist on our rotation, because especially as that palate is fused, if we know this, we're going to need to work to get that nervous system set around the palate changes that we're going to be unable to do at this time, but we still need to recognize and make that appropriate referral and work with these providers in our community to get to the base of these nervous systems, right? It is our absolute opportunity and place where we can be able to jump in here. So, long story short, yes, disafferentation. Dyskinesia equals disafferentation equals dyskinesis equals dysautonomia, the most important piece of the puzzle here. And I hope that you don't think that I'm ignoring our neurologically based spinal and nervous system based chiropractic care. It is what I live and breathe in my practice and have done for the last decade. And it is the most important thing. I just like to bring up some things that maybe we haven't thought about. Study is called 3-dimensional analysis of upper airway and craniofacial morphology in orthodontic adolescents with attention deficit hyperactivity disorder, a comparative study. We know that this is there. Start asking your patients with these symptoms and challenges, behavior challenges. I promise if you haven't, you will be blown away with the percentage of them struggle to keep their mouth closed, especially at night. And when we change that sleep quality for them, generations to come, baby. Thank you for joining the Cranial Doc Podcast for another episode. Info like this and more practice building, AI, automation, etc. is on my email list at thecranialdoc.com. It's free. There's a ton of good stuff for there. Jump on there, and I can't wait to see you for the next episode. Thank you for listening to another episode of the Cranial Doc Podcast. I hope you got a ton of value out of today's episode. And if you did, it would mean the world to me if you jumped over to iTunes or your favorite podcast player of choice and subscribed, rated, reviewed, and shared this episode with a friend that you know could benefit. We have a ton of this information and more in our free email series at thecranialdoc.com. So go ahead and jump on there, subscribe, and get me raw, unfiltered in your inbox every week, changing your practice. Can't wait to see you for the next episode.